So, first of all, infection. Okay, it means there is an invasion of some foreign particles. These foreign particles or substances may be virus, bacteria, parasite, any fungi, or any in some autoimmune diseases. What happens is the body some proteins in the body will undergo some alteration, and the body will think it's an outsider, and that becomes an autoimmune disease in which the body itself will attack its own cells. Okay, and that also is one type of infection. So yeah, so these are the different types of infections: viral, bacterial, parasitic, fungal. Prion disease, considered as an autoimmune disease. Okay, so again, there is a mode of transmission for different types of infection: droplet, airborne, and contact transmission. Contact transmission is infection which is transmitted directly when you touch when an infected person touches another susceptible host, or when an infected person uses certain articles which is used by unsuspecting host, etc. That is an example of contact based infection. Then we have droplet infection like chicken pox, influenza, common cold, etc. Those things are droplet infection. So droplets are a little bit heavier. So for example, if you are in the same room and within 3 feet, 3 to 4 feet of an infected person, you may get the infection through droplet transmission. Okay, and another case is airborne. Airborne, even if you're in the next room. Okay, if you're in the next room, you even if you're 10 feet afar from this infected person, you may still get the airborne infection, because in airborne mode of transmission, the droplets are very lightweight. Okay, these droplets and these um, dust particles which are infectious, they may travel through the air along with the air current. They may travel along with the air current and cause some infection. Okay, am I audible to all? Am I audible now? Is it clear? Is my voice clear? Okay. So, some examples of contact-based transmission is like chicken pox, common cold, okay, conjunctivitis, um, hepatitis, some hepatitis like A and B. Okay, these can be transmitted through contact transmission. Okay, meningitis, influenza, measles. Okay, these can be transmitted through direct contact. Okay, flu, most of the flus will be transmitted through droplet transmission, but when somebody coughs or sneezes, like tuberculosis, okay, tuberculosis is also droplet transmission. And airborne is like covid-19, swine flu, H1N1, okay, SARS. Okay, these are the examples of airborne transmission. So in airborne transmission, remember the infectious particles, okay, it may be virus, bacteria, some dust particles, okay, they are so lightweight that they can be expelled throughout the room, outside the room, okay, and in the surrounding area. So okay, so what happens, even the people who are outside this particular room where the infected person is situated, they may also get infected. So uh, that's the meaning of airborne transmission. In droplet, you have to be in very close contact, you have to be within 3 to 4 feet of this infectious person to get the infection, okay. So using mask just while taking care of the droplet infectious patients, okay, that can protect you. Using ppe and mask in this cases, it can protect you. In contact based infection, if you want to stay away from contact based infection, do not share articles, do not share personal articles with uh, the infectious persons. Do not touch them directly, or do not have any skin to skin contact with them, okay. Use gloves while dealing with their articles, dealing with their personal equipments, etc. Okay, that can help. So yeah, infections will have an effect on nutrition, okay. It is like, it's a cycle. If your nutritional status is down, you are at a larger risk of acquiring any sort of infections, okay. On top of that, if you get infected, again your nutritional status will fall much low, okay. So this is an ongoing cycle, it is interrelated, okay. um, Either your nutritional status will always uh, go down because of recurrent infections, or if you are not having good nutrition, you are at a larger risk of acquiring infection. So that's a cycle, that's a vicious cycle, uh, the relation between infections and nutritional status, okay, or infection or any malnutrition. So what the effects, we'll discuss that. Impaired appetite. When you are suffering from any sort of infections, obviously the person who is suffering will not have an appetite, okay. There will be various reasons associated with that. The infections or the disease may come with some gastric issues like nausea, vomiting, diarrhea, etc. In such cases, people don't like to eat food, they don't like to think about food, or their appetite will be lost. If they have some ulcers in their stomach, or ulcers in the mouth, okay, they have some chewing difficulty, breathing difficulty, in these cases the appetite will be affected. So impaired appetite, and because of that, automatically the nutritional status will go further below. Then we have impaired absorption. Even if they are having food, okay, forcefully, if you are feeding them something, but you can't expect the entire nutrition to be absorbed, okay. Because when a person is suffering from any sort of infection, whichever system may be affected, okay, automatically the GI tract will undergo certain changes in which it wants to conserve the energy as much as possible. So automatically the absorption rate will decrease. The absorption rate will decrease. Whatever food that you are feeding to an infected person, don't expect the entire thing to be absorbed. Okay, so that is the reason why when somebody is sick, somebody is having fever, or somebody is suffering from certain kind of infections, what we are doing here is high calorie and high protein diet should be given, okay. And if they're suffering from some nausea and vomiting, what we should do, we'll discuss that later. But remember that for infections and fevers, okay, in the initial few days, high calorie, high protein rich food should be given. Fat should be used judiciously, okay, moderately. Do not give them fried foods or something. But when it comes to calorie, carbohydrates and proteins, the diet should have high carbohydrates and high protein, okay. So that's the takeaway from diet in fever and infection. In any case of fever and infection, high protein and high carbohydrate diet should be given. Why, we will discuss that later, okay. Then increased requirement, because the metabolism, when we are suffering from fever, automatically our body temperature is high. When the body temperature is high, our body's metabolism is high. The body is wasting a lot of muscles, wasting a lot of tissues just by going into a state of catabolism. Catabolism means breakdown of complex molecules into simple molecules. So what is the opposite of catabolism? Does anyone remember? Catabolism means breakdown of complex molecules into simple molecules. Yes, right. The opposite of catabolism is anabolism, where simple molecules will come together and form complex molecules. But when we are suffering from fevers and infections, our bodies are in the state of catabolism. Okay, because there is a temperature spike, and to keep up with the temperature spike, the body undergoes a lot of metabolic changes, and usually it is wasting away a lot of protein stores and carbohydrate stores. That is the reason why uh, protein rich diet and carbohydrate high diet should be given for people who are suffering from fever associated with any infection. Okay. Drug and nutrient reaction, obviously, whenever you are getting treated for your infection, whatever medicines you are taking, whatever drugs you are taking, it will have some or the other negative reactions with the absorption of nutrient. Okay, when doctors are prescribing certain antibiotics or anti-infectives, okay, they are very well aware of how it is going to affect your GI tract, how this the absorption of this particular antibiotic will interfere with the absorption of other important micronutrients. Okay, so sometimes when we're treating infections along with antibiotics, you also get a prescription of multivitamins and minerals. Okay, that is done to keep in check that whatever excess micronutrients are being lost because of this drug interference, okay, at least with the help of multivitamins, that is getting absorbed, that stores which are getting depleted is getting restored. Okay, so that's how we can tackle the drug nutrient interactions. Then we have increased metabolic rate, as I have said earlier. With every 1 degree spike in terms of Fahrenheit, okay, in terms of Fahrenheit, when 1 degree Fahrenheit of body temperature increases during fever, okay, 7% of your metabolism, okay, 7% of your metabolism increases. So that's what we are looking at. If for example, let's say your metabolic state is around 50 to 60% in resting, while sleeping and while resting your metabolism was around 50 to 60%, but you're having fever, okay, a mild fever, there was just 2 degree spike from the normal fever, normal temperature, okay, that may lead to, even if you're sitting, you're just sleeping or resting, your body is still under the metabolism of around 70 to 80%. Okay, even without doing anything, you are losing a lot of fat stores and losing a lot of muscle stores. Okay, so this is this is what happens when somebody is suffering from a chronic disease, chronic infection, or somebody was having fever for a few days. When you see them after this resting 1 degree Fahrenheit, with every increase with 1 degree Fahrenheit, okay, 7% increased metabolism is seen. Okay, so yeah, when you see someone who was suffering for, let's say, they were on leave since few days because they were suffering from fever, when they come back to office or come back to school or college, okay, what changes do you see in them? Physically, just looking at them, they look thin, they look weaker, because during the stage of their fever, they had lost a lot of adipose tissue, they had lost a lot of carbohydrate store. Okay, so that is the reason why people look weak and thin as soon as they recover from fever. Okay, why this happens? For example, remember, uh, will the metabolism take place? If for example, you say that we should exercise so that our metabolism should increase, what's happening when you're exercising? Is your body temperature getting low, or your body is getting heated up with exercise? Okay, with workout and with exercise, your body temperature gets heated up. Okay, with this increased temperature, burning of the fats is easier. Okay, burning of the fats is easier. Apply the same theory when you are having fever. Without doing anything, your body temperature is already high. Okay, so this is how the body undergoes into a stage of wasting and loss of fat stores. Okay, so decreased glycogen and adipose stores. Glycogen is the carbohydrate store in our body. Adipose stores are the fat store, okay, lipid stores in our body. So automatically, when the body goes into the state of increased metabolism, these stores will get depleted out. Okay, it will get wasted off. Increased catabolism of proteins, so the kidneys will be having a lot of hectic time, because when the proteins are getting broken down in a very high rate, the kidneys has to process it out of the body through urine. Okay, so kidneys will be working overtime here. And loss of water and sodium, when the urine output is more. Okay, along with urine, a lot of sodium and potassium and other electrolytes will also be lost from the body. And also remember, when you're suffering from fever or infection, increased urinary output is a way through which your body is tackling this high temperature. Okay, because urine, when you urinate, when you sweat, what happens is a part of a temperature, a part of the heat from your body is being lost. Okay, it's been lost. So you increased urination is a way how your body is trying to combat this high fever situation. Okay, but along with increased urination, remember, you're also losing a lot of electrolyte, which has to be again put back into the body through ors, etc. So general dietary consideration for fever, okay, if somebody is suffering from general fever, some seasonal fever or any fever associated with an infection, okay, these are the general dietary guidelines we should follow. Okay, I will repeatedly ask the questions about it, because when we will be discussing few infections in the coming up slides, we will be following the same, this general dietary guidelines. So in that case, you will have to answer. Okay, please give me 1 minute. Am I audible now? Okay. So, general dietary consideration which you have to follow. Okay, anyone, if you are suffering from fever, or in your family, if somebody is suffering from fever, you come up with people, meet up with people who are suffering from fever. These are the dietary corrections which you have to give. The same consideration will apply in certain infections which we are going to speak after these slides. So I will be asking questions again related to this the same slide, so please keep that in mind. Okay, learn as we go ahead. So energy, even how much ever loss of appetite a person is having during the initial phases of fever, make sure they are having some liquid diet, some clear fluid diet, which would give them at least 600, minimum 600, and to 1000 to 200 kilocalories, not more than 1200 kilocalories. Why? Because we don't want to put the put extra taxing, okay, extra taxing or extra work on the GI tract, because already GI tract during fever is doing only half of its work. Okay, on top of that, if you are providing too much of energy and too much of high fat rich food for fever patients, most of the time they may expel it out through their body via vomiting, nausea, or any other gastrointestinal disorders. To prevent that, so that we do not overtax our GI tract, overtax our small intestine, keep the range of kilocalories per day within 600 to 1200 kilocalories. Include buttermilk or rice water, okay, something like that, and you will find it on Google, etc., how much kilocalories this one glass or 250 ml of skimmed milk, not heavy toned milk, skimmed milk can provide. Okay, how much energy can 500 ml of rice water, cooked white rice water or boiled rice water can provide. Okay, search about that. You will get an understanding throughout the day how many glasses you would have to give, how many class of how many kilocalories can one orange juice or one lime juice can provide. Okay, just search about this. Okay, and how can you increase the calorie here? Instead of adding sugar, use glucose. Instead of adding sugar, use glucose. One tablespoon of glucose will provide how much calories. Okay, add these things, do your own research in these areas, and try to formulate different diet plans for that. Okay, this is how you have to learn. If we give out whatever examples we have, you will not know how to creatively solve such questions and such problems in the future. Okay, so energy, keep it in mind, energy should be uh, between the range of 600 to 1200 kilocalories, not more than that, otherwise you will be overtaxing your incompetent GI tract during the fever phase. Then protein requirement is more than 100 grams, at least 100 grams or more. Usually when we talk about protein requirements, if it is the minimum amount of protein requirement per day for adults should be around 1 to 1 gram per kg of their body weight. Okay, in this situation, in the situation of fever, don't go for their body weight. Okay, keep a target of giving them at least 100 gram of protein uh, per day. Okay, so here when they are having a loss of appetite, giving them protein rich food to chew and eat, it will not be possible. The best other alternative is you can give them protein shakes. Okay, in that case, even the fluid volume will be maintained, and it is easy to ingest also during this particular period. Okay, protein, when we are talking about 600 to 1200 kilocalories, it is not just made up of protein, it is made up of carbohydrates, fats, protein, all the macronutrients coming together and giving the entirety of 600 to 1200 kilocalories. Okay, do not try to give them 600 to 1200 kilocalories only from protein source. It's a combination of carbohydrates, proteins, and fat that should get you to this particular range of kilocalories. Okay, then carbohydrates, be liberal here. Okay, be liberal with the carbohydrates, because it's not the protein that will first get absorbed by into the bloodstream. It is always glucose. Okay, that's why I had told earlier, do not use sugar. Use, wherever you are going to use sugar, substitute it with glucose, because that will readily get absorbed into the body, since the body is already under the stage of carbohydrate depletion. Okay, when body is already under the stage of carbohydrate depletion, go for glucose, automatically it will get absorbed into the bloodstream. So be liberal with the use of glucose in the first few days of fever management. Okay. Then fats we should be judicious in use. Okay, you can use good fats, medium chain triglycerides, um, MCT oils are available, etc. We will see that later. Okay, so fats, be judicious with the use. Okay, so we are saying here we should give them fats doesn't mean giving them fried foods, etc. That will compromise the functioning of GI system. Okay, whatever fats you're giving, make sure it has a good amount of omega-3 fatty acids. It should be not long chain triglycerides, short chain or medium chain would be good. Okay, minerals, calcium, phosphorus, and iron. These are the three main minerals we have to be very careful about during this particular phase of um, diet. Okay, calcium, phosphorus, and iron. And also sodium chloride, when you're giving them fluid diet like rice, salted rice water, okay, ORS, etc. When you're giving them ORS, automatically the sodium chloride levels will be up. Whatever electrolytes they have lost, it will be compensated. Okay, whatever dose of ORS the physician has prescribed, follow up with that. Then vitamins, vitamin A, C, and B complex is important here. Whatever diet you give, okay, and like for example, papaya milkshake or papaya juice, that can give sufficient amount of beta carotenes, and lime juice, amla juice, okay, like that. You have to make the diet plan, and something like, okay, vitamin A, C, B rich food, okay, not solid ones, but convert that solid ones into semi solid soft diet or liquid diet or clear fluid diet. That way you have to plan. Then fluid intake, remember this, the fluid intake which I have mentioned here, that is 2.5 to around 5 liters per day. This will include all the beverages, okay, like since mostly the person will be on soft diet and fluid diet and liquid diet, including that, okay, including that, the fluid intake should be around 2.5 to 5 liters per day, okay, including the water as well as all the other beverages which you have given them. The food should be bland. Irritants like spices and other extra flavorants, etc., that should be avoided. Keep the food bland, and because that sometimes what happens is that irritants like spicy foods, some peppers or chili powder, something like that, it can irritate the mucosal lining of the stomach, etc. And what food was supposed to be kept inside the stomach, because of this irritation, it may go, the person may throw up. Okay, so that is why keep it bland. Then the feeding time, even if it is a liquid diet or clear fluid diet, the feeding time should be around 2 to 3 hour intervals, and small content of milk. For example, 250 ml of a clear fluid diet, or 250 ml of a fruit juice at 9 p.m. 9 a.m. After 3 hours at 12, another fruit juice or barley water, something like that. Okay, after 3 hours, like that, the first few days we have to follow this pattern, but slowly, without any delay, semi-solid foods and solid food has to be incorporated in their diet within 2 days, not more than that. Okay, otherwise, to keep up with this high requirement of calorie, and depend this high requirement of calorie is completely dependent on fluid diet, it is not possible, because fluid diet has its other cons, other disadvantages, like the patient may feel that his or her stomach is over distended. Okay, and when it is fluid diet, as soon as after having the fluid diet, they cannot go and rest or lay down, otherwise they will vomit up. Okay, they may throw up. So there are lots of disadvantages of keeping a person on fluid diet for more than 3 days. Okay, and also on top of that, the calorie requirement, we cannot keep up with the calorie requirement just based on fluid diet or semi-solid diet. So slowly solid diets has to be incorporated. Dry fruits food should be incorporated, so that you can tackle the case of nausea and vomiting. So please keep all these points in mind. It's there on page number 277 to 278. About roti and rice, if the person is having a lot of vomiting, okay, if the patient is suffering from a lot of nausea and vomiting, give them roti with some dry bland curry or something, okay, because dry food, okay, the food which doesn't have too much of liquid, the food that is comparatively drier, doesn't have too much of water content, will be staying in the stomach for a pretty long time as compared to rice. Rice has a lot of water content to it while cooking, processing, and also while having, okay, rice has a certain degree of water content which is much more than roti. So if you're dealing with a person who is not suffering from nausea and vomiting, you can give them rice, okay. Otherwise, if they're suffering from a lot of nausea and vomiting, dry chapatis, okay, unoiled dry chapatis with bland curry or bland sabji, that will do. It depends on what other symptoms is associated with this particular case of fever, okay. Yeah, next is typhoid fever. The causative agent here is Salmonella typhi. It is found in contaminated food and water sources. Like contaminated food and contaminated water sources are the main reason through which somebody they should suffer from typhoid. So Salmonella typhi is the causative agent. There are people who are carriers for Salmonella typhi and others who just get infected of Salmonella typhi and get typhoid fever. So signs and symptoms, usually it will start with a white coating on the tongue because there's an incubation period. Incubation period is nothing but the day when this particular bacteria, it enters your body, okay, that is day one, and the day when you will first start seeing the symptoms, okay, whatever the day it is maybe on the 7th day, 14th day, at the end of the month, whatever, okay, the day when the organism enters your body and the day when you first start to see the signs and symptom, okay, that entire duration is called incubation period, okay. Every microorganism has their own incubation periods, okay. So Salmonella typhi has an incubation period. Usually, it is around 10 to 14 days. Like when the this bacilli enters your body, and well, the day when you start seeing the stomach ache, fever, and other initial symptoms. Okay, usually it is 10 to 14 days. This particular typhoid bacterium, it may take this many days to multiply and show signs and symptoms. Okay. So again, when it comes to milk, etc., if the milk is contaminated with Salmonella typhi, the milk will not change in its property, the flavor, okay, taste profile, appearance will not change in any way. That is the reason why most of the time it goes undetected. Okay, and that is the reason why we should always use pasteurized milk. Okay, do not use the milk which is directly from the cow's udder. Always use go for pasteurized milk because pasteurization helps to kill this Salmonella typhi bacteria. Okay, it achieves that amount of sterilization for milk and other milk products. So signs and symptoms: enlarged liver and spleen, hepatomegaly, splenomegaly. Okay, there will be ulcers in the intestine, and which we will call it as Peyer's patches. And on top of the body, there will be red spots, spider bites like spots. It's not this rashes on the body is not commonly seen in every case of typhoid, but mostly, largely, every case of typhoid will have hepatomegaly and splenomegaly, that is enlarged liver and enlarged spleen and ulcers in the intestine, because this bacteria will go into the small intestine and it will deteriorate and it will destroy the mucosal epithelium in your intestine. That's how it leads to ulcer formation in the intestine. So these are the signs and symptoms which we will see in typhoid. So how to manage a case of typhoid? You have to start with clear fluid diet, and slowly within 2 days, after 2 days of clear fluid diet, it should be full liquid diet, then liquid diet, then soft diet, semi-solid diet, then slowly solid diet. Okay, so that's the frequency you should follow. So examples of these different types of clear fluid diets is given on the screen. Also, we have already took a chapter on this particular segment in the initial few days. I guess it was the first chapter, different types of diets and diet therapy, etc. That was a chapter, I guess. So that repeated chapter will be coming up. So water, fruit juices, broth, okay, gelatins, jellos, okay, jellos you will get in the hospitals, etc. Those also are an example of a liquid diet. Sports drink, any fruit juice, popsicles, tea, coffee without milk, okay, like black tea, black coffee, okay. Those are the examples of clear fluid diets. And full fluid diets, it will include all the examples which we have just stated in the clear fluid diets. Along with that, when milk is also added, okay, in full liquid diet, when you include milk, in clear fluid diets, milk is not used, but in full liquid diet, milk is used. Cereals, porridge, okay, puddings, etc. Soups, cream soups, or clear soups, that is also used here. Then soft diet, like easy to chew, easy to swallow, like oats, porridge, chapatis which are soaked in milk, okay, or chapatis which are soaked in dal, okay, thin dal, not the thick dal, but the dal which is made on the thinner side, okay, chapatis which are soaked in thin dal, that is also a good a carbohydrate rich diet, okay, chapatis in dal, and khichdi, khichdi which is not thick but on the liquider side, okay, it's on the thinner side, khichdi that are thin, that is also a good source of carbohydrates as well as protein. So when it comes to the soft diet stage, you can give that, okay. Then low residue diet, which are easy to digest. High fiber should be avoided. Why we should avoid high fiber? Can anyone give example for that, reason for that? Until and unless if the fever has a complication of constipation, you can give fiber. But if the fever doesn't have an issue with constipation, fiber has to be avoided. Can you give an example for that? Yeah, because when it comes to fever, the most common symptom along with fever is loose motion. On top of that, yeah, already your GI tract is not working in its full fledged. Okay, whatever these different diets which you're giving to your patient, you can expect that only half or less than half of the nutrients are being absorbed. Rest everything is being excreted. Okay, so when you add fiber also in this particular case, nothing will, with all the diets which you're giving to your patient, everything will go in waste. Okay, so that is the reason why, to avoid these loss of minerals and vitamins, avoid giving them fiber rich food. Okay, like avoid high fiber rich food such as whole grain breads, cereals, nuts, seeds, dry fruits and vegetables. Okay, avoid these things. You can give the juices of the vegetables and fruits, removing the roughage. Okay, so that will ensure that the fiber has been removed, but the fluid quantity and the mineral quantity is being restored. Along with that, the glucose quantity is also there, so that will satisfy all the main criteria. But when you remove the pulp or remove the roughage, it will already automatically ensure that the fiber has been removed. Strain your fruit juices and vegetable juices and then give it to the fever patients. On page number 279, examples are there of the food which should be given and the foods which should be avoided. Okay, a small table is there on page number 279. Please follow that, how to manage the typhoid cases. Then coming to next topic, influenza. Any flu, okay, these are the symptoms which we'll find: headache, runny nose, stuffy nose, sinus is stuffy with mucus, sore throat, aches, fever, tiredness, malaise, extreme malaise, coughing, sometimes it is coughing, sometimes it will be just be runny nose, okay, vomiting, nausea, and muscle pain, arthralgia, myalgia. Okay, arthralgia means joint pain, myalgia means muscle aches. Okay, so these are the different signs and symptoms which we'll see in influenza. Influenza usually will get resolved within few days. It's an acute flu. It's a very acute fever. Okay, it is not chronic. Usually most of the influenza cases are acute. It will get resolved within few days. Okay, and too much of treatment is not required until and unless it is it has some symptoms which are extreme, like breathing difficulty, and mucus that has been stuck into the lobes of the lungs. Okay, when the oxygen saturation falls down. So these are the extreme examples, extreme symptoms in which treatment is required. Other than that, most of the flu cases can be managed at home. Okay, and some flus which we have shots also. So yeah, general dietary consideration which we follow for fever, the same thing we have to follow here. So based on the discussion which we had in few slides back about how to manage a fever patient, okay, whatever comes to your mind, just put it in the chat box. The main thing which you took from that particular discussion, how to manage, what calories we should keep in track, what is the protein requirement, etc. Which is one good source which will give exactly 100 gram of protein. One good source which will exactly give 100 gram of protein. Yeah, chicken breast and all, it's not ideal for during fever. Okay, chicken broth. Okay, chicken broth and all which we can give, that a person can easily digest. Okay, but giving the exact uh, chicken breast, etc., that would be little bit taxing on the GI tract. Okay, bone broth, yes, bone broth is a good source of protein. Any bone broth, red meat or white meat, doesn't matter. Yeah, moong dal on the liquid side. Okay, not on the thicker side. Khichadis, yes. Yeah, eggs. The dahlia is good for protein as well as for carbohydrates, but it is much more for carbohydrates. Avocados, some people may find it nauseating. Okay, if others, if they don't find avocados nauseating, especially during this particular fever time, okay, then you can give them. So about the question which I asked, okay, one good source which can give you 100 gram of protein. It was a tricky question. Okay, how frequently should you be giving food to a person who is suffering from fever? How frequently? Can you just give 100 gram of protein and all that 600 to 1200 kilocalories in one go? No, right? Yeah. So don't depend on only just one part of the macronutrient and get stuck on that. Okay, divide the for example, 100 gram of proteins, there are n number of permutations and combinations which you can make. Okay, like just boil the rice and strain the rice water, mix it with dal water. Okay, if you want to make a completely clear liquid diet, which is good source of carbohydrates as well as protein. Okay, put enough water in dal, cook it. Okay, and strain the dal water, cook the rice and strain the rice water, mix these two things together and give it to the patient uh, every 2 to 3 hours. Okay, keep it in store and give it to the patient every 3 to 4 hours. Okay, at least one time a day, give them a hard boiled egg. When you see the nausea has been resolved, you can give them one hard boiled egg. One hard boiled egg can meet at least one-fourth the requirement of protein for the entire day. Okay, skimmed milk. Okay, put the skimmed milk in any fruit juices, give it as skimmed milk milkshake. Okay, like that you have to make some permutations and combinations, and think about it. In one go you are not supposed to give this entire calories, because that will be too much of taxing on their stomach and intestine. Always remember 2 to 3 hours and divide this entire 100 gram of protein, liberal use of carbohydrates, divide that into the 2 to 3 hours interval throughout the 24 hours, and that's how you maintain a nutritional status for a patient who's suffering from fever. Okay, yeah, kanji, when it comes to rice porridge, that's what we call it as kanji. In South India, it is quite common. Okay, it's like khichdi, but it is on the blander side. Okay, so yeah, this kind of techniques you have to use. Okay, so next topic is malaria. So the causative agent of malaria, the malarial parasite is Plasmodium. We have various categories of types of Plasmodium: Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, Plasmodium falciparum. Okay, vivax and falciparum are on the sides which will give you severe symptoms. Okay, Plasmodium malariae and Plasmodium ovale are on the milder side. Okay, so yeah, malarial parasite requires a human host body as well as a female Anopheles mosquito host body. It requires two host body to complete its life cycle. Okay, so the female and first you can see in this image the first infected mosquito. Okay, this mosquito has the parasite. When it bites the human being, okay, so this parasite will be injected into the bloodstream of the uh, human host, and in the liver cell it will undergo differentiation. Okay, gametocytes will be formed, and these gametocytes of this parasite will be released into the bloodstream. Your RBCs, your red blood cells, will be carrying this parasite. Your red blood cells will get infected. These infected red blood cells will be carrying this parasite throughout the body, and next another uninfected mosquito will come, bite the human being, and during that bite it will take up the infected red blood cells with the gametocytes, and the remaining life cycle of the parasite in the form of gametocytes, it will take place in the mosquito's body. So it requires two hosts. One is a human host and one is a female Anopheles mosquito. Okay, these two hosts are required to complete a single life cycle of the parasite. Okay, so these are the main signs and symptoms in malaria. High and reoccurring continuous fever. For example, early morning they had high fever, and after few hours they are suffering from chills. Okay, they are having shivering, and then it is just high fever and profuse sweating. Again, in the evening they are suffering from chills. Okay, they are shivering. Okay, so that's an intermittent profuse sweating and intermittent chills. Okay, and even the chills, it is like shaking. You can see the tremors happening sometimes when you feel chilly while when you are having a fever. It's something you perceive but others can't see. But shaking chills means the tremors you can actually visualize in a person who is suffering from malaria. So this is the recurring continuous fever. The fever comes and goes again and again. So that's one sign and symptom. And along with the fever, okay, there are intermittent stages of profuse sweating, excessive sweating, and then with suddenly there is the episode of shaking chills, and again sweating and again shaking chills. Okay, so when you see this graph going up and down, it may be a case of dengue or malaria. Even in dengue and chikungunya, you'll see the same pattern, more or less very similar pattern. Okay, and along with these chills, sweating, and high fever, there will be headache. In some cases, vomiting, diarrhea will also be associated with malarial symptoms. Okay. So regarding the diet, here again, the same thing you have to follow. What dietary consideration you will follow for a patient who is suffering from fever or any influenza? The same dietary considerations you have to follow for a malarial patient also. Okay, it's the same. The dietary consideration for fever is same for these two cases. Next is tuberculosis. In About tuberculosis, by 2025, India has planned to get completely eradicate the tuberculosis completely from the country. Okay, so revised national tuberculosis program, which is again renamed to something else over a period of from the time when this tuberculosis program has been born in this country. It has undergone various updation, various name change. The same program, the same Ministry of Health and Family Welfare has changed the name of this national health program many times. Earlier it was RNTCP, Revised National Tuberculosis Control Program. Now it is something else. So it has been changing. But yeah, why tuberculosis is such a big deal in India? We are ranking number one. Okay, among all the countries in the world, India ranks number one when it comes to the prevalence and incidence rates of tuberculosis. Okay, so do you think lungs is the only organ which is getting affected by tuberculosis, or do we have any other types? Yes, the tuberculosis which is most common is pulmonary tuberculosis, that is the chest tuberculosis which affects your lung. Okay, on top of that we have tuberculosis which affects your abdomen, your stomach, your intestines. Okay, small intestine, large intestine. Okay, your bones, your lymphatic system, your brain. Okay, your brain tissue, your spinal cord. Okay, your liver. Okay, there are different types of different variants of tuberculosis. But with regards to the statistics which we have, pulmonary tuberculosis is the most common one. Okay, pulmonary tuberculosis is the most common one. It is easily transmittable because is it an airborne infection, droplet, or contact infection? Tuberculosis. What is the mode of transmission for tuberculosis? Is it airborne, contact, or droplet? Tuberculosis is a droplet mode of transmission because if there is someone who is sitting in the next room, or the room, not in the same room as you but in the next room, he or she is suffering from tuberculosis, doesn't put you at the risk of tuberculosis. Okay, you have to be somewhere 3 to 4 feet in front of them or near to them. Okay, in their entire radius, the infected person's entire radius around 3 to 4 feet. If you're somewhere without mask, okay, without any personal protective equipment, without any mask, then you are at the risk of acquiring tuberculosis. Okay, otherwise, if you are in the second room, next room, you are 10 feet away from this particular infected person, you are not at the risk of getting tuberculosis. Okay, that becomes airborne. Like COVID, in COVID we had this issue: keep 6 feet distance from each other. Okay, so that why that was given, because it's an airborne infection. Okay, even if we are 6 feet apart, it will not save you. If a COVID patient has sneezed or coughed in front of you without mask, okay, and if it was a windy day, or if the fan was on, okay, these air currents can propel this virus, propel this virus infected dust particles into your mucosal lining, in the nose, in your throat, in your mouth, or even in your conjunctiva, and that's how you get COVID infection. Okay, so that becomes airborne. But when it comes to the droplet infection, the droplets which has this Mycobacterium tuberculosis, okay, Mycobacterium tuberculosis, they are quite heavy. Okay, they're quite heavy, and they will fall down when the patient coughs or sneezes. It will fall down somewhere near in the patient's 3 to 4 feet radius. Okay, it cannot be propelled too far because it is on the heavier side. The mycobacterium is larger than 5 mu microns in its size. Okay, in hospitals we require isolation ward for TB, because there are many reasons. Like, in hospitals, do you expect all the other patients to have good immunity, or are you seeing patients with who have compromised immunity? Even the visitors, the patients who are at the OPD. Okay, so what you can do here, you are having 10 people who are having already their immunity is compromised. On top of that, you have a TB patient. What can you do here? You have to isolate the TB patient, right? Okay, so that's the reason why we have isolation ward. And on top of that, when you are having an isolation ward, for example, given the health status, healthcare infrastructure in India, especially in public healthcare hospitals, um, our hospitals can't afford to have isolation wards, or a complete entire hospital which is an isolation hospital. Okay, we can't afford to have that case. So what we can do here, we can cohort the patients together. Cohorting the patients means putting all the TB patients together in one ward. Okay, so that is also safe. Okay, because the healthcare workers who will be addressing to the needs of these patients, they will wear their PPE, and they will be vaccinated. They will be checking themselves. They will be doing the Mantox test, etc., on time. So they will be on the safer side. But putting all the TB patients together, it will make sure that our resources are not compromised. Okay, because we can't afford to keep each and every TB patient in separate private isolation wards. So we can do that also here. The only reason being, we have to safeguard the health of other patients in the hospital. We have to safeguard the health of other visitors in the hospital, as well as the healthcare staff. Okay, so that is the reason why we have isolation wards for TB patients in the hospital. Okay. On top of that, TB also has various variants. Nowadays, we are seeing multi-drug resistant TB. Multi-drug resistant TB. The classical rifampicin, isoniazid, pyridosmine, and ethambutol, which we used to give in DOTS therapy, it is not working on these patients. We have to come up with new high-end antibiotics to tackle the MRT, multi-drug resistant TB. Okay, in that case, when you are dealing with MRD cases of TB, you have to keep that TB patients completely separate in single isolation ward. That we can't risk. Okay, for them, even if you do not have if the hospital doesn't have the resources, this multi-drug resistant tuberculosis patient will be sent to state level or district level tuberculosis care center, where their needs will be addressed, but they will not be kept together with other TB patients or any other patient in the hospital, for that matter. Okay, so that's how we are dealing with tuberculosis as of now. The virus, the bacterium, the Mycobacterium tuberculosis, the bacilli, is getting stronger day by day. So it is getting difficult for the pharmaceutical companies to come up research and come up with new variants of antibiotics which can tackle this particular bacilli. Okay, so coming to the signs and symptoms of TB, okay, night sweats, fever. Okay, in the initial stage of acute stage of micro this tuberculosis, high fever will be there. But if it is a chronic stage from a lot of months, few months and few years, this particular person is suffering from tuberculosis. The fever will not be that high. It will be there. Persistent fever will be there. Body temperature will be slightly higher than normal range, but still it will not be high fever. It will be just a mild fever. It will be persistent on and off again, okay, throughout the year. But if it is an acute case of tuberculosis, high fever will be seen. Night fatigue, tiredness, sweating at night, fevers, chest pain. And when you do the x-ray, we can see the lung damage. But nowadays x-rays are not only the only source of diagnosis. We do rapid acid fast bacilli test, okay, that is required to confirm the diagnosis of tuberculosis. On top of that, the main thing is persistent cough, persistent nagging cough, and the cough has mucus. Along with mucus, where if the blood vessels in your lung get eroded, you will see fresh blood along with the when you cough out, along with the phlegm, you can see the fresh blood. Okay, so that's one classical sign of tuberculosis. So these are the anti-TB drugs which we use. The four drugs: isoniazid, rifampicin, pyridosamine, and ethambutol, and streptomycin also. Okay, these drugs are given as a part of these drugs are free of cost. Okay, the central government of India takes care of the entire funding. The Ministry of Health and Family Affairs, they will take care of the entire funding for this DOTS therapy. DOTS means direct observed therapy, short course. That's the abbreviation for DOTS. So it's all these medications are given free of cost. Earlier it was 6 months. Now it is kind of 9 months. Nine months extensive therapy with these drugs. And newer drugs which you can see here, second line and newer drugs. So erythromycin, rifampicin, ofloxacin, ciprofloxacin. Along with that, second line is used in MRD cases, multi-drug resistant cases. So this is a small, the four things which you have to remember here is isoniazid, rifampicin, pyridosamine, ethambutol. It is given in the textbook. Okay, the abbreviation you can use here is RIPE, RIPE. So with that you will remember you can use this mnemonic of RIPE to remember the drug names. It's important. Okay, from exam point of view, the anti-TB drugs is important. Everyone should know. If you're dealing with in a medical fraternity now, since you're a nutrition and dietetics students, you are in the medical fraternity for studies, you should have the knowledge of anti-TB drugs. Okay, it's on page number 281. They have given. You can use this mnemonic of RIPE to remember the anti-TB drugs. So the diet for TB, energy is 2500 to 3000 kilocalories. Does anyone know the reason why we are having we have to maintain such high degree of kilocalories for TB? Because there was one sign and symptom which I had not mentioned in the slide. But if anyone has any idea, people who are from the medical field, from the science background, if you have any idea. Extreme weight loss is one of signs and symptom in TB. Okay, extreme weight loss and muscle wasting. It's true. Two people have said that extreme weight loss and muscle wasting is two main symptoms of tuberculosis. To tackle that, we have to provide the patients a nutrition which can give them this much amount of calories. Okay, but not more than 3000. This amount of calories should be given so that their weight management can be done. Okay. Protein, again, 80 to 120 gram. Here you can do the weight calculation. The average being at least the person who is suffering from TB, at least 3 to 3.5 gram per kg of the body weight. That has to be multiplied to the entire body weight. Okay, calculate that, and that at least that amount of protein should be given to TB patients, because they lose a lot of protein in form of the cough, mucus and phlegm which comes out. Okay, so a lot of protein wastage is gone in that way. Calcium, iron and phosphorus, these three things, these three minerals, okay, has to be kept in mind. Calcium at least 600 mg per day. Okay, iron, calcium and iron again on the same meal, do not give them calcium on in a different meal, iron in a different meal. Keep that in mind, because calcium may interfere with iron absorption. Then vitamins A, vitamin C and vitamin D, enough sources, rich food sources of these three vitamins. High calorie diet, fluid diet and soft diet in the initial few days, and after that solid diet has to be included. But high calorie diet has to be maintained till the day when the acid fast bacilli results become negative. Okay, acid fast bacilli results, the day when it becomes negative, again it has to be rechecked within 2 weeks. When 3 to 4 consecutive tests of this acid fast bacilli results are negative, we can say that the patient is free of tuberculosis. After that, the high calorie diet can be reduced, but till then, if the patient is infected with mycobacterium tuberculosis, till then high calorie diet has to be given. During the fever, if the till the fever resolves, okay, as long as the person is suffering from acute fever, high fever, every 3 hour interval soft diet can be given. And when you start the ripe dots treatment, okay, you will see improvement in the patient's health status. And when you see that improvement, when there is no recurring fever, when the cough is under control, okay, weight is static, the weight is not decreasing, it is static. Even if they have not gained excess weight, at least the weight remains static, not decreasing. When you see these kind of improvements, high protein diet, at least 1 liter of milk, 3 to 4 eggs. Remember, I told you earlier, one egg will give you around 1/4 of that 100 gram of protein. Okay, so 3 to 4 eggs will automatically make sure that at least 90 gram of protein is being provided every day. Okay, on top of that, 1 liter of milk to compensate whatever remaining protein amount has to be compensated. Do a like morning, give 1 liter, half liter of milk, 500 ml of milk, 1 egg. Evening, half liter of milk and 1 egg. And in between, using dal, khichdi, pulses, cereals, you can incorporate these sources of protein and make sure the protein requirement is met. Okay. Now, next, coming to AIDS, acute immunodeficiency syndrome. Yeah, whole egg, including the white and the yellow egg yolk and albumin, because earlier they used to say that the yolk is not healthy, but now few researchers have shown that it's not true. Okay, eating the egg in its entirety, including the yolk as well as the albumin, is better as compared to having only the white. Okay, new researchers are coming up. Okay, new researchers are coming up. So yeah, coming to AIDS, acute acquired immunodeficiency syndrome. So HIV and AIDS are two different things. HIV is human immunodeficiency virus. Okay, it's a virus which will get into inside the human body, and it will directly go and target the T lymphocytes. Okay, the helper T lymphocytes, and it will kill the antibodies which are naturally present in the body. Okay, so that's how this virus functions. It will go into the DNA structure of this helper T cells, etc. It will make a copy of itself. This virus will go into the DNA using the reverse transcriptase enzyme. Okay, it will convert the DNA into the RNA, and it will create its own copies, and that's how it spreads throughout the body, and it will go and attack the helper T cells. So along with spreading into through the entire body, it is killing the antibody which is supposed to protect the body against HIV. Okay, so that's how HIV spreads. So it's a human immunodeficiency virus, HIV. Okay, AIDS is a combination of different disorders. Okay, so syndrome means various diseases and disorders have come together, and usually it is the last stage of an entire lifetime which with HIV. Okay, AIDS is usually the more critical and the last stage of HIV. Okay, after getting HIV infection, only a person over a period of 10 to 14 years, it may take 10 to 14 years to reach the stage of AIDS. Okay, so the HIV virus, it will invade the immunity system, and the patients will suffer with minor difficulties. Okay, like they will get frequent flus, if it is a even if it is a slight change in seasons. Okay, they will easily they will get flu, they will get infections very easily. Okay, so yeah, they are these are the small minor difficulties which they will suffer from for at least 10 to 14 years, and then it will progress into AIDS. Okay, so AIDS is the acronym for acquired immunodeficiency syndrome. Okay, it's mostly the large stage of the spectrum of HIV. So patients here in who are suffering from AIDS, their quality of life will be affected. Okay, they will be completely bedridden. Their daily care, their personal hygiene, their daily nutritional requirement, everything will be dependent on their caretakers. Okay, so that's the stage in AIDS. The life quality of the people who are suffering from AIDS is completely destroyed. Okay, they will experience severe signs and symptoms from the infections which they were suffering from the past 10 to 14 years. Okay, and severe wasting of muscles. They will become extremely thin. They will be becoming extremely skeletal. Okay, so complete loss of protein from their body, complete muscle wasting in their body. That's a symptom in AIDS. That is one of the disorder in AIDS. Protein allergy, malnutrition. Okay, that's one of the disorder in AIDS. So there are a few stages, 4 stages here: the primary, asymptomatic, symptomatic, and final, the HIV, which has converted into AIDS. Okay, so in primary, as soon as the virus enters one's body, okay, it will last for around 1 to 6 weeks after the infection. There is no symptoms at all, not even a small fever will be there. So the person unknowingly may be transmitting this infection to others. Okay, because they themselves do not know, they themselves have never come across any symptoms which may indicate otherwise. Okay, so in primary stage there is no symptoms at all, and even in the primary stage itself, a person can transmit the infection one person to another. Then we have the asymptomatic stage. From the name itself, we can say uh, it will last for around 10 to 15 years. Okay, and asymptomatic means there is no symptoms. Okay, there is no symptoms. They will be living a completely normal life without any symptoms which shows they may be suffering from AIDS. Okay, so there may be swollen glands. There swollen glands means the lymph nodes will be swollen, but it may be underruled. If ELISA test is not done, it can be underruled. Okay, HIV antibodies are detectable in the blood if they do an ELISA testing. Okay, their HIV antibodies will be detected. And in the symptomatic stage, after this 10 to 15 years, this stage 3 will start. Here the symptoms will be mild, slowly recurring fevers, and persisting flus, which is not getting better day by day. Okay, even a small infection which is supposed to get better within 2 to 3 days, it doesn't get better like that. Okay, so that kind of situation you will see in the stage 3, that is symptomatic stage. And this is the emergence of opportunistic infections and cancers. Okay, here when a person is in this third stage of symptomatic stage of HIV, this is where extra caution has to be taken care. This is very when it comes to the environment of India. Okay, um, do you think we have kind of a natural immunity against TB, Indian population? To an extent, do you think we have a natural immunity, natural resistance to TB? Yes, we do have. Okay, for example, many of us in our entire lifetime, we may have not suffered from TB, or we may have never got diagnosed for TB. Okay, but do you think in any point of your life you may have inhaled the Mycobacterium tuberculosis bacilli, but your body protect you against it? It is very much possible because the this Mycobacterium tuberculosis bacilli is very much spread around in our environment. Okay, especially in the populated cities, populated areas. Okay, this tuberculosis bacilli is very much spread out in our environment, in each and every if you are from a metro city, if you are from a city which is on a populated side. Okay, on a population side, not pollution, populated city. Okay, in your lifetime, in various point of days, okay, you may have inhaled Mycobacterium tuberculosis, but you have you might have also received BCG vaccine when you were born. Okay, that have given you the resistance. On top of that, over a period of time, we Indians already have a natural resistance. To an extent, we have a natural resistance to tackle TB. Okay, so but this resistance, this natural resistance which we have gained over all these years, and also the acquired immunity which we have gained with the help of BCG vaccine, these things will not work for these HIV patients in this symptomatic stage. Okay, even in the past, if they had a natural resistance, this is the time where that resistance will also fade off. So in this stage 3, in the stage of symptomatic stage, okay, they have to be very cautious. They have to go around, they should not be mingling in the populated areas. Okay, in the public areas, because they will be putting their life at risk of acquiring small infections which would turn into life threatening conditions. Okay, in some cases they will see the onset of cancers also, benign tumors which may convert itself into malignant cancers. Okay, so that happens in stage 3. And stage 4, it is the final stage. Immunity is completely deteriorated. The immunity system is completely deteriorated, completely weak. The illnesses which they have acquired, even after taking so many cautions and precautions, okay, whatever illnesses they have acquired during the stage 3, that will lead into the chronic, that will be undergoing worsening. Okay, that will lead into severe symptoms, and finally it will lead to death. Okay, so that's the final stage of HIV to AIDS. So the nutritional requirement here, sorry, the nutritional problems which we see here in HIV patients: decreased nutritional intake, because over a period of time, especially when they are in the stage 3 and stage 4, there will be anorexia. Their systems, okay, multiple system failures may be there. It depends from one case to another. No two cases of AIDS will look similar. Okay, the underlying infections will be different, the underlying malignancy will be different. So yeah, for because of these various factors, there will be a decreased nutritional intake, because there will be ulcers in their GI tract, in their stomach, mouth, gums. Anorexia will be there, because of certain depression of after coming to know that they are suffering from this disease, and some the social stigma that is associated with AIDS, etc. They may go into a stage of depression, etc., that will affect their nutritional status. So there are various factors. Some factors have been listed on the textbook. Just go through that. Okay, dysgeusia is given. The medical terminology for that is impaired sense of taste. Okay, so that the taste receptors are not working, that tongue will not be sensitive to taste. So because of that, it may lead to decreased nutritional intake. Okay. Then we have gastrointestinal malabsorption. It's a, as I told earlier, it's a vicious cycle. Once you are infected, your GI system is down. It will not absorb the nutrient. You will again go into the further into the state of malnourishment. So GI malabsorption. Also, this is because of any other ulcers, peptic ulcers, intestinal ulcers, any changes in the intestinal epithelium. Okay, all these factors will come together in play. Then increased nutritional requirement, because there is an extensive muscle wasting, lots of protein has been lost from their body, and severe weight loss, energy loss. Okay, their carbohydrate stores, glycogen stores, everything is depleted. So because of that, their body is automatically in the state of increased nutritional requirement. But because of decreased intake, because of other social factors, okay, they are not able to meet their nutrition requirement. So that becomes the socio psychosocial factors. Poverty, because the disorder of AIDS is much more common among the low income groups, among the sex workers, those who are in the ignorant and illiterate group of people who doesn't know how actually AIDS get transmitted. Okay, they do not have enough knowledge on this aspect of the disease. Okay, these are the areas where AIDS, the diseases like AIDS and HIV is much more common. Okay, so the social factors come into play: poverty, limited access to healthcare, limited access to healthcare knowledge. Okay, these are the reasons why we see nutritional problems in HIV patients. Then we see micronutrient deficiency. It is given in the textbook. Just read about it. Zinc, especially zinc, uh, vitamin E. Some examples are given in the textbook. Just read two few paragraphs are given. Just give a read it through. It is not that important. Okay, because when we are in the state of nutritional depletion, it is not just, we don't have to just worry about micronutrient. We have to worry more about the macronutrient. Okay, like carbohydrates, proteins, fats. Okay, these are the things which we have to worry more. Okay, micronutrient, obviously when the macronutrient are not getting absorbed, micronutrient have very less chance of being absorbed. So yeah, this is the vicious cycle of HIV. It will weaken the immunity. When the immunity is weak, you are more susceptible to infections. And when you get infections one after the another, that will lead to your GI system not functioning properly, and that will lead to malnourishment. Again, it follows the same cycle. Malnourishment will again weaken the immunity, because if you are not properly nourished, your immunity will get weaker and weaker. On top of that, you are suffering from HIV. Again, the vicious cycle will continue. Okay, this is not given in the textbook. It is just for your understanding. I have placed it here, this particular flow chart. So coming to the components of medical nutrition therapy, screening. As soon as a person is diagnosed with HIV, their complete nutritional screening has to be done. Okay, in the initial phase of HIV, what is the nutritional status? Because with regards to that, we have to keep the nutritional status as static as possible. It should not go down. The nutritional graph should not go down, and that's why we use the referral services. Some in some cases, PHCs do not have enough resources to provide these nutritional services, so we require referral services. We have to refer them to ART centers, to the counseling centers, where NGOs, etc., where they may get help. Okay, especially when they are from the low income groups, they do require the help of certain institutions like NGOs, like NACO. Okay, for some financial and non-financial assistance may be required for their sustainable living. Okay, then again, after when you ensure they are using the referral services, they are using the government provided nutritional services, etc., keep on the assessment. Nutritional assessment should be going on. Okay, as long as they live, as long as they get their life to live. Okay, nutritional assessment should be going on, because based on that, various various medications, various prescriptions can be done. Because when a person is having HIV and when they're on ART, antiretroviral therapy, okay, it these drugs are not easy on the body. Okay, ART drugs have a lot of side effects. The even if it is a single drug, nowadays it's a single drug which has been used for AIDS, depending on if it is a pregnant woman, if in which stage of AIDS they are. Okay, depending on that, the number of drugs which we used to use earlier has been reduced. So even with that reduced number of drug, it has a lot and lot of side effects on the body. So based on that side effects, again, nutrition will not be completely absorbed by the body. So continuous nutritional assessment is required. Okay, and then finally we will take interventions based on the diseases, the based on the various infections the patient has acquired. Along with that, treating that particular infection, on top of that, dealing with the nutritional status and dealing with the HIV status, dealing with the viral load. These are the things we have to compact. First, we will start with screening. Okay, first we have to start with screening, then referral services, then continuous assessment throughout their lifelong assessment has to be done, and during this assessment interventions will be given. Screening, like their weight will be checked, their blood samples will be taken. Okay, what is their vitamin levels, vitamin A levels, vitamin B levels, serum retinol levels. Okay, all these levels will be taken initially, and going forwards, frequently every month, okay, or every 2 weeks, that blood samples will be collected. The with the initial record, it will be compared, and the graph will be drawn, graph will be plotted to see how they are performing, how they are responding to the oral supplements, how they are responding to the ART therapy. These things will be screened. Okay, referral services will differ from primary healthcare centers, secondary healthcare centers. Okay, what services NACO gives. Okay, all these things will come under the referral scenario. Then assessment, again, um, assessment is the stage where the counseling comes into play. Okay, integrated family planning rooms in the hospitals. Okay, that's how we call it. As we when you go into the hospital, you will not see the placard or a board for AIDS counseling room. Okay, because to protect the identity of the AIDS patient, we can't use such placards. Okay, so under other nomenclatures, like some counseling rooms, okay, family counseling rooms, family planning counseling rooms, under that names we give AIDS counseling to the HIV people living with HIV, and to the AIDS patients. Okay, so this counseling will come under the assessment. In the assessment, those who are trained with this counseling, they know what questions to ask. Okay, what questions to ask to understand what is the mental state of this particular patient. Is he or she depressed? Are they anxious? Okay, along with the physical incapabilities, are they suffering from any mental trauma? Okay, these things will be assessed here. Okay, along with this kind of counseling, nutritional counseling will also be done, nutritional assessment will also be taken up. So that's the examples for assessment. In intervention, it is a vast sea of intervention which we have. Okay, for example, a case 1 of HIV, they may have got tuberculosis in the stage 3. Case 2 of HIV may have got cancer. The intervention for these two cases will be completely independent of each other. Okay, it will not be same. So intervention depends on what underlying infection this particular patient has acquired over a period of time. Okay, what underlying deficiency this particular patient has acquired, what is the nutritional status, on top of that what oral supplements we have to give, what nutritional supplements we have to give, should we change the ART combination drugs which we were using for them. Okay, that kind of interventions medical staff will be taking. Okay, so about this screening, referral, assessment, and intervention, this is mostly the work done by the NACO team, as well as the people who are associated with the NACO team. Okay. Other than that, you just have to understand. Okay, these are the steps which will make which will make the components of nutritional therapy. Okay, but it is classically taken up by medical professionals who are in the field of work for controlling AIDS. Okay. Then oral supplements, MCT oil. So MCT oil, which is derived from, some MCT oils are derived from coconuts, some MCT oils are derived from palm oil. Okay, and the MCT oil which is derived from coconut oil, that is most commonly used. So you can aids the people who are living with HIV, they can be guided to use MCT oils because that is much better fat which is absorbed by them, and it will help in weight management. And hydrolyzed whey protein, they can use hydrolyzed whey protein to compact the loss of protein. And different sources of medium chain MCT means medium chain triglyceride. Different sources of MCT is given here. High protein, high calorie diet has to be maintained for HIV patients. Omega-3 fatty acids, beta carotene rich food. Vitamin C and vitamin E, at least 5 servings of fruits and vegetables per day. At least 5 servings of fruits and vegetables will ensure that enough amount of vitamin C and E is received by them. 5 servings of fruits and vegetable means at least 2 servings of fruits, 3 servings of vegetables, or 3 servings of fruits throughout a day, 2 servings of vegetables. Okay, depending on their appetite, what they like, what they dislike. Okay, like that diet plan has been created here. Food which is rich in vitamin B12, because that helps in neuropsychological abnormalities. If the person is suffering from some neuromotor disorders during AIDS, vitamin B12 rich food will take care of that. What are the sources of vitamin B complex? We will study that in the next nutritional class, etc. Then vitamin A rich food, that has shown that, as I said earlier, HIV virus will try to kill all the helper T lymphocytes. So having vitamin A rich food helps to ensure that the immunity stays up, because when we discussed about vitamin A in the previous class, I had told you how I have explained how vitamin A is important when it comes to keeping our barrier immunity strong, like cilia. Okay, how to keep how the vitamin A will keep the barrier immunity and the first line of defense strong. Okay, so that's how vitamin A will help to keep at least whatever immunity is left, to keep that strong. Then, and about antiretroviral therapy, there's a various combination of ARP drugs which is used, not a single drug, but a combination of drugs used. For pregnant women, it is a different combination. For lactating women, it's a different combination. For adults, it is different. Okay, so different combination of antiretroviral drugs are used. So we have the course of infection control and prevention management. In that, we have discussed in detail about the AIDS counseling and what kind of drugs to be used in occupational safety, etc. If anyone is interested in joining that course, you can contact me later. So ART is on a daily basis, ART drugs is given. Okay, so on a daily use of combination of HIV medicine is given. So it saves lives, but it will not cure HIV. Okay, it can make sure you have a better opportunity of having a better quality of life along with living with HIV. Okay, some people can have at least a better quality of life. That's what ART ensures. So it reduces the amount of HIV virus in the body. Risk of HIV transmission is reduced. It is not completely eradicated. It reduces the risk of transmission. Doesn't mean a person who is having ART drugs, they cannot transmit AIDS. They can still transmit AIDS. Okay. Prevents HIV from advancing into AIDS. Like that is what, when it becomes AIDS, when HIV turns into AIDS, that's when the quality of life deteriorates. But with ART, we can at least push back the time of AIDS coming soon. Okay, it protects the immunity, it protects the immune system from further infections. ART has certain effects on nutrition, as well as nutrition also has an effect on ART, because certain combinations of ART drugs may interfere with the absorption of certain microminerals. Okay, so that examples are given in the textbook. You can read that. So these ART drugs can decrease the appetite, as I told earlier, because it will lead to nausea, vomiting, diarrhea. Okay, so because of these feelings, people may not like to have food. It can cause metabolic changes, like intravenousal drug. It can raise the blood sugar levels. RPT drugs can worsen the triglycerides level or cholesterol levels. So drug can cause vitamin disturbances. It can interfere with the absorption of vitamins, especially vitamin B6, etc. So INH, LPV, these are the full forms of different forms of ART drugs. You don't have to worry about that. No need to study about ART drugs. Okay, but understand this thing: ART drugs will interfere with the nutritional absorption and its chemical function in the body. Okay, and sometimes nutrition will affect the functioning of ART. It can interfere with the mechanism of action of ART drugs. It can make sure that the drug does not get absorbed. Okay, some food can hinder the drug absorption, like having excessive fat in the food. Okay, unhealthy fat in the food that will interfere with ART drug absorption. Certain minerals like zinc, certain vitamins can help minimize the drug side effects, like having vitamin B12. Vitamin B12 will make sure that the side effects of the drugs are reduced. Alcohol can exacerbate the side effects of drug. It can worsen the side effects of the of ART drugs. And what all side effects ART drugs has, it has been listed down on table 14.1. It's on page number 287. Okay, 287 and 288. Different side effects of ART drugs like anorexia, nausea, vomiting, loss of taste, constipation, diarrhea, fever is given, and how to tackle that. Okay, what are things we can do to what recommendations should we should follow, what things we have to avoid. It is given on that table. Just read through that, very easy table. If you read that, you can use these techniques for any infection and disease. Okay, this is your self study task. Please read that, understand that. Okay, not just for people who are with ART, but people in general who are suffering from these side effects because of drugs or because of any infection. You can follow the same techniques there on page number 287. 287 and 288 table. If you have any doubt, please mention here. If it is a general doubt, please ask me in the personal WhatsApp. Only this topic related doubt, please ask in the comment chat box. ARV and ART is one and the same thing. ART means antiretroviral therapy. In textbook, they have took ARV means antiretroviral. That's it. But usually we use ART, antiretroviral therapy. That nutritional requirements is a generalized version. Okay, generally you have to follow this instruction for all the HIV/AIDS patient. Okay, the nutritional management which is given the table is because of the side effects of ART drugs. Okay, in case of the extreme side effects of ART drugs, what you have to do is given on the page number 287. 286, it is a general knowledge for how to treat or how to nutritionally manage AIDS patient or HIV patient. Okay. If somebody is suffering from upset stomach like bloating and severe diarrhea, in along with fever and cold, if they have this particular disorder of upset stomach, in that case buttermilk and curd is a good option. Okay. Otherwise, if it is acidity accompanied with fever, etc., then milk is a better option. Okay. There are certain myth associated with curd and buttermilk are cold, so it should not be it should not be given during like when somebody is suffering from cold, etc., or flu. Usually it's a myth, but you can have that if because curd and buttermilk has lactobacillus. If there is a case of upset stomach, it means your stomach doesn't have enough lactobacillus, and because of that you are having indigestion or diarrhea, etc. So in that case buttermilk and curd obviously will help. Okay.